likes to bring the myths and get dispelled with some facts. And I'm here with Dr. Sheila Pack today. Welcome back, Dr. Pack.
Thank you.
And today we have an Am I Going to Die from Falls? Like falling down, like you've heard. I've fallen and I can't get up. And while that has a bit of a humorous, thing to it, it can be very serious too. And if you're like me, I think I'm called like the sandwich generation, where have kids that I need to take care of, but I also have parents that are aging that I want to make sure that they're really set up for as much active and independent living as possible. So that's where falls come into all of this. And it happens to be National Fall Risk Awareness Day. That's a mouthful. Coming up on September 23rd. Each year we have a National Fall Risk Awareness, because falls can be prevented. But I think a lot of us, and I didn't know about the significance of it all until I was in this business and really working on building out a physical therapy model where we can prevent falls. So Dr. Pack is here with us because my first myth or fact is falling has nothing to do with the ear. We have a new prop on set today.
I love my props.
And wait, does it light up?
It does.
Wow. So you would not use that if you fell and you wanted to hit it and you want somebody to come and help you? It wouldn't get very far.
No.
Especially if they can hear you.
No. So basically the ear is very, very heavily related to falls. And let me explain a little bit about the anatomy first of all. So your inner ear is composed of two parts. It has the cochlea, which is your hearing organ, and it has the vestibular system, which is your balance. So the two share space inside the inner ear. They're kind of neighbors. So what happens to one can very often affect the other. In fact, one of the most common complaints we hear in ENT is, and whether it's in the clinic or even at a party or what have you, the first thing people say is, "Oh, I got dizzy today. I must have an inner ear infection." It's very common. But taking it a step further, what we do know now is there is a very high correlation between hearing loss and falling. So statistics out of Johns Hopkins are telling us that even someone with a very, very mild hearing loss, extremely mild hearing loss, has triple the risk of falling.
Wow.
And as the hearing loss increases, the amount of hearing loss increases, so does the risk of falling. So that's kind of, that's kind of fairly new technology. Yeah. And I think people are always asking, well, I don't understand why. What does that have to do with anything? But really, if you think about it, when you can't hear and you're in challenging environments, you're using a lot of your mental resources to try and focus on speech sounds and sounds around you. And we don't realize what balance and gait, what kind of a load that takes, what kind of a cognitive load that takes. So you're so busy trying to hear that you don't have those resources left to keep you upright. So
wow.
That's
the
link.
Deep, right off the bat, right there. But we've got all the knowledge here to help you through this today. So how about this myth or fact? Balance is not affected by the heart. That's a big one.
So, should I ring my bell again?
Oh boy, yes, every chance you get. Let's play with it.
Okay, balance is not affected by the heart. Okay.
So your heart can affect whether you fall down.
Cardiovascular. And so what you have to think about here is, I guess what comes to mind with me is you get out of bed, you get up too quickly, or you bend over to tie your shoe and you go like that, and you get that lightheadedness, because that you can have blood pressure drops, you can have low blood pressure, you can a whole host of things. So yes, the two are related. Can be related.
Heart issues can also contribute to your falling.
Yes.
or increase.
Mm-hmm.
That's dangerous too. So let's go to falling doesn't increase my mortality rate.
Actually, falls are the leading cause of accidental death in all of those over the age of 65.
I bet everybody out there knows somebody who loved one says, I've got to, I can't, come to this engagement. My father just fell. My mother just fell, or my cousin, fell down the stairs or into the driveway. So, you hear that, and then it's almost like we almost dismiss it. Like, oh, it's a fall. It'll be all right. We'll go take care of them, whatever, it's clean up their scrapes and then go back to normal life.
Right, right.
But truly on this Fall Risk Awareness Day, there are things you can do for yourself or for a loved one and encourage them to get sort of therapy to decrease their risk of falling.
Exactly.
So I think that's the best news that we could share with you today. Sheila, you went and played around in our physical therapy gym today.
I did. I had a great time over in physical therapy.
We have a great, great gym. We've got one on the north side of Atlanta and one on the south side of Atlanta. But tell us what you played on and what some of your experiences were with it.
So I had heard of a study that was looking at using how effective treating your hearing loss with hearing aids, what kind of effect that might have on improvements with balance. And so this one study showed up, and it's actually a landmark study, and what they did is and I brought my hearing aids today to show you, but what they did is they took people who had hearing loss, and physical therapy has a foam piece, and what you do is you stand on it, and there's a test called the Romberg test, which you stand, your feet are in different positions on this foam, and it's eyes open and then eyes closed. So basically what they did is they put the patient on there with their hearing aids off and did a Romberg and kind of observed their movements and so forth. And then they put the hearing aids on. And what they found was really interesting, that when people did wear their hearing aids and treated or controlled that hearing loss, they did much better on this test. So the movement kind of didn't stop, but slowed or kind of decreased significantly. So that was then Johns Hopkins study revealed that those people that wear their hearing aids actually maintain their balance twice as long as when they take them off. So
Let's talk about this one. How about that there are devices that can detect someone falling?
Yes.
Metal can't use it.
No. No, I can't use it this time. MedAlert, as we all know, that type, the necklace.
But there's better than that.
Well,
MedAlert, you have to press it, right? Or does it automatically go off?
I really don't know. But I think people associate that with help, I've fallen, I can't get up, that type of thing. But what there is now, and especially since we know, the risk of untreated hearing loss and balance and falls, we now have hearing instruments that actually monitor and have a fall detection alert system built into them. So
that is super cool. So,
it really is.
You could have a watch, right? That I think the watches do some sort of that monitor, but this can tell us how that works a little bit more.
So actually, you've got in your app, you'll put 3 contacts in your app when you set up the system, and if this hearing aid has kind of a motion sensor in it. And a lot of people get very confused. They say, well, what if you drop it? Well, it knows. When you drop a hearing aid, it's very quickly. When we fall, it's more of a progression. It's a little slower.
Right.
So it looks at the rate of fall, and based on what it picks up, it will send an alert to those 3 people on your contact list. And it gives you a chance to say, "Oop, false alarm," before.
Just testing to see if you're paying attention to me.
But what it does is it's what I find is I've got people that like this system because with some systems it contacts a central monitoring and they're not quite ready for that yet. But this will go like to your son or your daughter and just say, hey, we've detected something that may be a fall. You check up on your check up on them.
Right.
So that's new. Same hearing instrument, getting ready to come out with a heart rate monitor as well. So yes.
So hearing instruments that could certainly help you hear better, but also so many other features and functions to improve your life. They're really becoming like another wearable device.
Yes. Yes. So they're calling them a healthable.
A what?
Healthable.
Healthable. Wow. That's a whole new
device.
term. I just learned something new today. But
there you go.
One more fact or myth for you, and then tell us, walk us through some more things. But dizziness and vertigo can be tied back to medications.
Yes. You're not giving me a chance to ring my buzzer.
Oh.
Yes, they can. In fact, and this is, dizziness, the term dizziness, very subjective. You ask people, are you dizzy or do you have vertigo? Oh, all the time I get up and I just kind of feel lightheaded. But dizziness, vertigo, very affected by medications. In fact, I printed off like a list of very common, some of your antibiotics, antivirals, your Parkinson's drugs, all of these things. If you read the first warning or what have you, may cause dizziness.
Right.
So
what do you do if you have somebody who's on medications and says they're dizzy, but truly as the healthcare provider, there's more to it, right? Like there's a decline in the vestibular system because that just comes with age.
Right.
And there could be hearing loss. So lots of other things can contribute to this.
Right. I think typically the first person to pick up on this is the primary care physician. And then the typical course of action is they will refer to the ENT. Because anytime someone has a balance issue in ear, nose, or throat, we have to rule out that it's not inner ear. And so we have different steps that we go through. So the patient scheduled with the ENT, they always have a hearing examination. And then we can do a course of balance testing, which can help us determine a possible cause or a probable cause. And then based on what it is, in our practice, we very often refer to physical therapy for vestibular rehabilitation. And
so would you say to somebody, no matter what their age is, but would you say there's hope for them?
Oh, definitely. Most definitely. People even offer courses, and I think we're getting ready to have one.
We have a couple of different courses that kind of go through both of our departments, but one, we are offering a free fall risk kind of like how to prevent yourself from falling, how to, strengthen your balance.
Right.
And how, if you do fall, how to get up, because that could be tricky, depending on your age, right? Those things could be tricky. So we have that workshop coming up, and then you've got something else coming up, which kind of ties into the falling, but the tinnitus.
Tinnitus management. Yes. So tinnitus, ringing in the ears. Tinnitus, tinnitus, depends on where you're from.
Oh, Dr. Goforth told us an itis is like appendicitis, but an tinnitus is the right way to say it. He schooled us.
There you go. Well, yes, we do call it tinnitus in our practice. But yes, tinnitus, we'll very often see tinnitus also along with some of these other balance disorders, and tinnitus medications, just like medications can cause dizziness, they can cause ringing in the ears. So,
wow. So much of that ties together. And I think the most important thing to say is, well, first of all, are you going to die from falling?
Yes, you can.
You can. But there's ways to really work on an anti-falling campaign for personally for yourself. So many things. The use of hearing instruments to improve your hearing, along with a strengthening routine in physical therapy that knows your vestibular system and your balance.
Right.
And those two are like a 1-2 punch.
Yes, yes. So there's definitely
so you don't have
treatment.
to die from falling.
No.
You can be preventative now and really get some of the right treatments. And we're always available for any questions that you have. And don't just look at if you're on some sort of medications and it says, oh, it may cause dizziness, and just say, it's my medication. Don't do that. Take it a step further, right?
Definitely.
And reach out to experts like Dr. Pack and the ENT Institute. Message us if you have questions, because I mean, that's what we're here for. So, you don't want your loved one to die from falling. You certainly don't want them to fall and really start to lose their independent living, their quality of life, because there's ways that we can all help you guys stay more active and independent. So that's kind of our message for today. Do you have any parting thoughts for our viewers?
I think the only thing I want to say is if you do fall, make sure you tell your physician, because a lot of people hide it.
They're embarrassed.
And it's important. Right. It's important to know.
But there's solutions out there. Even if you fall, there's solutions out there, not to say and give up on, but to come and get renewed hope.
Exactly.
So, as always, thank you so much for being here.
You're welcome.
I love it. She brings the props. Do it one more time for good measure.
All right, a parting gift.
And if you have any questions for us, any show suggestions, let us know. Comment below. That's what we're here for. That's what we want to give you, more things to watch and entertain yourself, but also to educate yourself. So have a great week. Go get your fall risk awareness and a hearing screening, and you'll be well on your way for a long life of active, independent living.